issue of adjuvant bisphosphonates has been highly fascinating but also highly controversial in recent years. And my plenary lecture is kind of giving an overture to what I consider to be a practice-changing presentation of a meta-analysis, which will be given after my plenary lecture. The main issue is that we have been struggling with clearly identifying which patients are actually benefiting from adjuvant bisphosphonates, and I think we have now clarified this. If you are postmenopausal, low on estrogen, either by natural menopause or treatment-induced, then this is the subgroup of patients who derive the maximum benefit. In fact, the difference in disease-free survival and reduction of breast cancer mortality is quite remarkable. It's between 25 and 35% in the different trials. So personally, I believe for this patient group, this should be considered a standard of care in the future. I think so far we had some trials giving positive results, others were, not showing a difference. And we have been struggling in defining, well, how can you explain this? You have large trials and one of them shows a huge benefit and the other one shows almost no benefit whatsoever. I think we nowadays understand, based on this recent meta-analysis, that it depends on patient selection. It depends on the host microenvironment factor, which is defined by menopause, basically. So if you are postmenopausal, which is 3 out of 4 breast cancer patients in the Western world, then yes, you will derive benefit from adjuvant bisphosphonate therapy. If you are not postmenopausal, then you should not get this treatment. It's, in the end, it's a rather simple conclusion. I don't think so. I mean, we have trials now on 20,000 patients, basically, and all these agents are generic by now, so there is no more industry development, and still we haven't had that conclusion yet. So I think this is the particular significance and importance of this year's San Antonio, that we are now able to clearly state how these things work, and for whom we should not extrapolate this data. Actually, it is mostly hormone receptor positive breast cancer, but we now also have data from other patient subgroups, and this is very interesting. In fact, it does not depend, the efficacy does not depend on tumor characteristics. So it solely depends on the menopausal status of the patient, either by natural menopause or with some treatments for younger patients, like ovarian function suppression treatment, we induce artificial menopause, and these patients are benefiting as well. I think the clear message after today's presentation is in a low estrogen environment, so either by artificially induced premature menopause or in a clearly postmenopausal patients, adjuvant bisphosphonates should be considered because they reduce breast cancer relapse and eventually they help saving lives.